Welcome to this next part of the series, the 4-part series on sleep. In the first part, we had actually focused on the causes of sleep disorders and what is it that defines good sleep, and also the various ways in which one can figure out whether one's sleep is proper or even take the help of professionals to find out any issues regarding sleep. In this next part, we are basically focusing on the current medical treatments for sleep disorders. The first question to Dr. Jolie Thomson in this regard is, what are the main treatments available currently for sleep disorders?
For the sleep disorders, depending on what type of sleep problem, there are so many medicines are available to induce sleep and maintain sleep, and also to prevent the excessive sleeping also. So there are conditions in which the people are excessive sleepers. So there we are giving the brain stimulants actually. In the other, you're suppressing the brain and go to make it sleepy. There are different benzodiazepines and also this melatonin, one of the hormone which is secreted by the brain pineal gland itself, that also available. And also there is the newest addition is actually melatonin agonist. Melatonin, it is not melatonin hormone, but it is showing some action of the melatonin. And also there is another hormone or which is stimulating the brain. It is and this is actually orexin, one of the hormone sort of thing. It is again it is opposite of the melatonin. So orexin agonists are also there. So that is actually another one of the latest addition that is very costly nowadays to get it also. It's very costly now because it's a new medicine. And sort of so many medications are available to put you in sleep. But the problem is that is actually you can develop, most of these medications can develop side effects, especially this addiction problem that is more common with the benzodiazepines. So that is the major problem. So we cannot take this sleep medicine as a major part of the treatment schedule, because you can, if you are starting using it just like any other medications for the diabetes, it is a lifelong medicines, and for the diabetes, hypertension is also lifelong sort of thing, and this also will get into that. So ideally we should definitely think of the reason for the problem and get out of the problem itself, not depend on medication for sleeping.
Actually, as you mentioned, normally the medications associated with sleep disorders tend to be acting primarily in the brain. So there is a fear that most of them can result in some sort of addiction and a lifelong attachment to that, and naturally the side effects will also be at a bigger scale. Now, we also hear that when we are looking at treatment, we should actually explore other options for treatment other than solely depending on medications. What are the non-medication treatments available for sleep disorders?
See, other than the medication, actually what should be first tried is to have a very good sleep hygiene. That means go to sleep at a particular time, preferably around 10 o'clock. That is maybe the best timing for 9 or 10. And put an alarm for 8 hours and get up. If you're going for 10 o'clock, you can put alarm at 6 o'clock and get the habit that you go at the same time. Or at least half an hour or 1 hour changes also. It may not make much difference, but always try to sleep at the same time. And to see that you're avoiding the screen time, that is TV, for mobile and for computer and all, at least half an hour to 1 hour before stop. Because the screen, this light from the screen, not only the electric light, this light from the screen also is will not allow your brain to produce this melatonin. So you need melatonin hormone for the induction of the sleep. So, and also the other stimulant food items, stimulant food and drugs, this caffeine, tea, And those things you should avoid at least before 4 or 6 hours, because its action will be long for the it will at least caffeine, 1 glass of tea, and keep you alert, prevent you from sleeping even for 6 hours. So such behavioral changes should be the you should try. Next is actually you have to think of is the whether the medications which is you are using is making you not sleepy. Because I have seen patients who are taking the psychiatric, those who are sleep disorder, and at the age 70 or 75 years, and so many medicines they are taking, which is mainly used for 3-4 medicines for the psychiatric, because many of the patients will be having diabetes, for the medication for diabetes, hypertension, medication for hypertension, heart disease, this blood thinners. Blood thinners, when you are taking, you will be having acidity. And most of this aspirin and clopidogrel and all will be taken at night. And with all these medicines, you are going to sleep. And it will be very difficult for you to sleep. And also this hypertension medicines, 2-3 hypertension medicine also will be there at night. So it will actually interact in different ways on your brain and your stomach and so many problems. Actually, for ideally you had to, this all lifestyle diseases, the sleep problem is a lifestyle problem, and also this which is leading you into that this diabetes, hypertension and everything, it's also a lifestyle problem. And most of the patients, especially this obese patient, if you are able to reduce 10 or 15 kg, your diabetes will be gone, hypertension will be gone, sleep apnea will be gone. And I had seen many patients who was on continuously the CPAP machine for sleep apnea. But they can come out of it within 2 or 3 months itself, not even usually within 2 months, because within 2 months they will be able to get around 10 to 15% of weight reduction. That is sufficient to come out of this CPAP machine. And not only from the CPAP machine and the sleep problem, you can come out of diabetes and hypertension also within a month itself. Actually, this diabetes and hypertension, if you are doing the things the correct manner, the lifestyle correction, I'm not talking about the clinically supported lifestyle correction which I am giving to the patients. I don't not with the self correction. I don't think if you are many people say that I'm doing everything correctly, I have a very good habit of doing exercise and my diet is very healthy and everything, even though I am having diabetes, hypertension and sleep disturbances and all is there. That means if you are doing everything correctly, you should be able to come out of these diseases. So everyone, the knowledge will be limitation for each person, their own understanding about the correct, that is the problem. Actually, if you are in the scientific way, if you are able to correct the lifestyle, you should be able to come out of this almost all the lifestyle diseases. And that is, I'm telling not from the or medical literature or anything, I'm telling from my own experience actually.
Often we hear that, many of those who are having sleep disorders, they have the very little chance of overcoming it. Means primarily it's a question of managing it. That, if you have sleep apnea, you manage sleep apnea with CPAP or some other facility, or if you have insomnia, you manage it with some medication. So basically everywhere the thought is of managing it, and generally what happens is managing it has its limitations, because after some time the body finds out some other way of overcoming that management, and then you have to go into another treatment. So how do you see the possibility of managing such disorders in a holistic way?
See, sleep is very essential for the body, just like food, air, that is breathing, and also activity. You cannot correct the sleep without correcting your food and activities. If you have a problem with the sleep, it will be aggravating the other lifestyle diseases. Like if you have a sleep problem, definitely it will aggravate The anxiety, depression, diabetes, hypertension, if you don't have a good sleep next day morning, your sugar will be high and also your BP will be high. So everything is actually connected. You should understand that basically our body is just food. Body is made of food. Only thing, the vegetarians take maybe only vegetables, vegans take only vegan food, not milk or egg. And non-vegetarians take everything. So whatever you are taking, the final nutrition taken is the same. So only thing from which or this thing your nutrition is derived. And what all things other than the nutrition, what is getting into your body? If the theophylline or the caffeine, which is getting into the body, it is not a nutrient, it is a stimulant. So it will reduce your sleep. And if you are taking medications like sedatives, you will be sleepy in the next day. The working hours also you will be sleepy. So it is what you are taking into your stomach. It is through whatever, even in the inhalers, any form, even this smoke, this tobacco smoke, it is a stimulant. So if you take tobacco, then definitely you won't get a sleep. So this aspect to be corrected. If you are able to correct this, your lifestyle, your food, and your exercise pattern, basic exercise is a need for the body. If that is not there, you will not be getting the stimulation from the bone, that hormones or cytokines from the bone and the which is released during the activity from the muscle and bone. So it will also affect your brain's activity also. So what you need is, it is first understand that it is a lifestyle disease. You are not able to sleep, or you are not able, you are doing excessive sleep, it is not because of the lack of medicine. It is because of this, many of the time it may be because of the medicine. And you are overweight not because of the lack of this surgery. You are getting sleep apnea. It is only because excess fat stored in your body, especially in the neck and around the respiratory pathway. So you get rid of those unnecessary things and you will be able to sleep properly.
Actually, in some cases, we see that even surgery is sometimes resorted to handle sleep disorders. What is the role of surgery in handling and overcoming sleep disorders?
Yes, many of the ENT surgeries, this ear, throat and ENT specialist doing surgery for actually this sort of sleep problems, especially in children. The sleep will be affected. And why? Because of the adenoids and the tonsils are enlarged. The air passages will be blocked. In that, the surgery usually done is removing the tonsils and removing the adenoids. But we should understand that these adenoids and the tonsils are one of the very important for our immune system. Actually, all the this a major defense station from the air, from the mouth and the nose, whatever microbes are coming, they are catching it. But what is happening now, so many children is undergoing this adenoidectomy and tonsillectomy, even at a small age, at 2 years, 3 years and all, is because of the bad food habits. They are given so many junk food, which is containing so much of color preservatives, these food additives. And even this yellow color, sunset yellow, and so many, there are even 10,000 approved food additives are there. So you can imagine all these things, mainly the children are eating. There's all the junk food like fries and sweets and whatnot. Everyone knows that, and everyone gives the children also this junk food. So they are taking it, and their tonsils and adenoids poor. They are not able to handle all these toxins. Actually, the immune stations of adenoids and this tonsils is not only handling the microbes, they are handling the other toxins also. You can see that if you look into close watch of your child, after eating an ice cream or some junk food or some artificial fruit juice or the soft drinks, the child is initially getting a throat pain, and then they are going into this tonsillitis and adenoiditis, and most probably end up with a course of antibiotic. And this will be repeating in every month. Most of the parents, I had seen that every month there will be one course of antibiotics, and finally, because the adenoids and the tonsils are not able to handle, they will be enlarged, they are hypertrophic, and again these problems are coming, so it is restricting the air passages, and finally because the child is not able to breathe properly, and finally the patient is the parents are deciding to remove the adenoids and the tonsils, or one of them. So actually that is because of your bad way of bringing up the child, giving bad food to the child, your child is getting this problem. Next, for the adult also the same. I am talking about this adenoidectomy and tonsillectomy for the children. And for the adult, what is you are doing? This many people will not be able to, don't like the CPAP machine to put up. So for that, there are some surgeries also. Here also, these people who's having this sleep apnea, most probably this will be having allergic tendency also. So because of the allergy, when there is a allergy, which especially attacking the respiratory tract, your sleep will be disturbed. And for that, for a short time, you can put some nasal drops and nasal decongestants tablets, or in the form of drops or the spray we can use. But it is not a long-term solution. And also, I had seen patients, adult also. I think one boy, he was around 27 or something. He was been undergone this nasal septum surgery and also tonsillectomy. And his problem is not over. He's very uncomfortable, and actually psychiatric medicine also he's taking, because he's not able to sleep, or she's not at all comfortable in the day also. And he was asked to remove the adenoids also. In that stage, he came, actually he was obese, and within 2 or 3 months, his problem is totally gone. He's able to, actually, when he is coming to me, he has got a job, but the father is very worried whether he will be able to do that. It's got a good job actually, but because he's going very mentally problem is there. So they came, and actually within he was taking psychiatric medicine and anti-allergic and decongestant, everything he was taking, but within 1 month itself, or no 2 months, his medication and over, and he was able to reduce 10 or 15 kg. His problem is over. So that is so simple. And even if he had come before this, the nasal septum operation and the tonsillectomy, there was no need for doing those things also. And the most important thing, especially when you are doing in the respiratory pathway or the oral cavity and all, after the surgery, there is always a chance of fibrosis and fibrosis. That is the way of healing it actually. So it can even increase the problems further. And for the sleep apnea, another surgery done is to removing the uvula. You have, when you open the mouth, you can see there is a small tongue, small this globular thing hanging down from your anus. That part and the part of the soft palate is removed. So that is also actually can create future more problems. But always think of, if you are willing for a lifestyle correction before going for any of the surgeries, think of lifestyle correction in a proper way. And if you can see that your lifestyle correction is getting corrected, you are in the correct path if you are doing itself. If you are overweight, your weight is reducing. If you are not able to reduce your weight in the expected way, then that means your lifestyle correction part is not going in the proper way. You need some support for that.
In this second segment on sleep, we went through the modern medical treatments available for sleep disorders. In the next part, we look at the complications associated with sleep disorders and also the common comorbidities associated with sleep disorders. Thank you.